Warning: 3 reasons you might be denied. Dental coverage this month. Something is happening quietly across Canada right now. Thousands of seniors who expected to receive dental coverage under the Canadian Dental Care Plan are being told they don't qualify. Not because they didn't apply, not because they missed a deadline, but because of eligibility rules that many Canadians still don't fully understand. This is Joseph, and if you or someone you know has been counting on this new federal dental program to finally get coverage after years without it, you need to understand exactly why applications are being denied, what triggers these rejections, and what you can do before it's too late. Because right now, confusion is spreading. And for many seniors living on fixed incomes, being denied this coverage isn't just disappointing, it's financially destabilizing. Let's break down exactly what's happening. The Canadian Dental Care Plan, often referred to as the CDCP, was launched by the federal government in late 2023 as part of a broader effort to expand healthcare access for uninsured and underinsured Canadians. The rollout began with seniors aged 87 and older in December 2023, then expanded to seniors 77 and up, then 72 and up, and eventually to all seniors 65 and older by May 2024. By mid-2024, the program opened to children under 18, adults with disabilities, and eventually to all eligible Canadians with family incomes under $90,000. The promise was clear. If you don't have dental insurance and your household income falls below certain thresholds, you could access federal dental coverage for the first time. For millions of Canadians, particularly seniors who have gone decades without dental care, this was transformational. But as applications flooded in, so did the denials. Advocacy groups, community organizations, and dental offices across the country began reporting the same pattern. Eligible Canadians were being rejected, often without clear explanations. Some were told they had existing coverage when they didn't. Others were flagged for income levels they couldn't verify or didn't understand. And many simply received form letters stating they were ineligible, with little guidance on how to appeal or correct the issue. According to Health Canada, more than 3 million Canadians have enrolled in the CDCP as of early 2025. But behind that number is another reality. Tens of thousands of applications have been denied or delayed. And for seniors who rely on old age security, the Guaranteed Income Supplement, and the Canada Pension Plan as their only sources of income, losing access to dental care can mean avoiding necessary treatment, worsening health outcomes, and escalating costs down the road. This isn't just a bureaucratic issue, it's a retirement security issue, and it's unfolding right now. So let's be very clear about what the Canadian Dental Care Plan actually requires, and where the confusion is coming from. Eligibility is based on 3 core criteria. First, you must be a Canadian resident with a valid social insurance number. Second, your adjusted family net income must be under $90,000 per year. Third, you cannot have access to dental insurance through any other source, whether that's private insurance, employer coverage, retiree benefits, or provincial or territorial programs. That third criterion is where most denials are happening, and this is critical to understand. Reason 1. You're flagged as having existing coverage, even when you don't. Many seniors are being denied because federal databases indicate they have dental insurance, when in reality, they haven't had coverage in years. This often happens because a spouse or former spouse had workplace benefits that have since ended. They were covered under a group plan that was discontinued. Provincial seniors programs are being incorrectly flagged as insurance. Records were not updated after retirement or job loss. In some provinces, seniors receive limited dental benefits for emergency care or specific procedures. But these are not the same as comprehensive dental insurance. Yet the CDCP application system sometimes treats them as disqualifying coverage. This has been especially problematic in provinces like British Columbia, Ontario, and Quebec, where seniors' drug or health programs exist but don't include full dental benefits. Reason 2. Income verification issues. The CDCP uses your adjusted family net income from your most recent tax return to determine eligibility. But for many seniors, especially those who are recently widowed, recently retired, or living with adult children, income calculations can be complex. If you file taxes jointly with a spouse, the combined income is used. If your income fluctuated due to RRSP withdrawals, pension adjustments, or one-time capital gains, you may be pushed above the threshold temporarily. If you haven't filed your taxes yet for the most recent year, the government uses older data, which may no longer reflect your current financial situation. And if there's a discrepancy between what you reported and what the CRA has on file, your application can be delayed or denied pending clarification. Reason 3. You didn't disclose all household income sources. This is more common than people realize. If you're living with an adult child and that child's income pushes the household above $90,000, you may not qualify, even if you and your child file separate tax returns. The definition of family in this context includes spouses and common law partners, but can also include dependents and co-residents, depending on how the application is processed. Some seniors have been denied because they receive modest income from part-time work, rental properties, or investment accounts that they didn't think needed to be disclosed. Others have been flagged because their spouse receives a workplace pension or benefits that weren't clearly reported. The system is designed to be thorough, but it's also unforgiving when information is incomplete or inconsistent. So who is being hit hardest by these denials? Seniors aged 65 to 75, who retired in the last 5 to 10 years and lost employer dental benefits are among the most affected. Many assumed they would qualify automatically once they turned 65 and lost workplace coverage. But if their income is just above the threshold, say $92,000 or $95,000 due to pension income or RRSP drawdowns, they're denied. Widows and widowers are facing particular challenges. When a spouse passes away, income often drops. But if the surviving spouse hasn't filed a new tax return reflecting that change, they may still be assessed based on joint income from the previous year. Low-income seniors receiving GIZ are generally eligible, but even here, some have been denied due to data mismatches or outdated records. Seniors living with adult children are being denied if the household income exceeds the cap, even when the senior's personal income is very low. Immigrants and newcomers to Canada who don't have complete tax filing history are also experiencing delays and denials. And finally, rural and remote Canadians, particularly in Indigenous communities, are struggling with access to application support, leading to errors, incomplete forms, and rejections. This isn't affecting everyone equally, but it's affecting enough people that the pattern is now undeniable. Let's talk about what this actually costs. Dental care in Canada is expensive. A routine cleaning and checkup can cost between $150 and $300. A filling can range from $150 to $400. A root canal can cost $800 to $2,500. Dentures can run $2,000 to $5,000 or more. For seniors living on fixed incomes, especially those receiving only CPP and OAS, with monthly incomes between $1,500 and $2,500, these costs are simply out of reach. Many have been avoiding dental care for years, sometimes decades. The promise of the CDCP was that they could finally address chronic pain, missing teeth, gum disease, and other conditions that affect not just oral health, but overall health. Being denied coverage means continuing to delay care, and delayed dental care leads to more serious health problems: infections, malnutrition, heart disease, diabetes complications, and increased reliance on emergency rooms. From a financial perspective, Seniors who are denied CDCP coverage face a choice: pay out of pocket and sacrifice other necessities, or go without care and risk worsening health and higher costs later. Neither option is sustainable. For a senior spending $1,000 to $2,000 per year on dental care, that's 5% to 10% of their annual income. That's money that could have gone toward rent, groceries, medications, or utilities. The financial impact is real, immediate, and compounding. So why is this happening? Why are so many Canadians being denied coverage under a program that was supposed to expand access? The short answer is fiscal control. The Canadian Dental Care Plan is expensive. The federal government has committed billions of dollars over the next several years to fund it. But with rising deficits, inflation pressures, and demographic shifts, namely a rapidly aging population, there's enormous pressure to control costs. Strict eligibility criteria help limit enrollment, and strict enforcement of those criteria helps ensure that only the truly uninsured and low-income Canadians receive benefits. From a policy perspective, this makes sense. The government doesn't want to subsidize dental care for Canadians who already have access to coverage or for those who can afford to pay out of pocket. But from a practical perspective, the system is catching many Canadians in the gap. People who technically have access to coverage that's inadequate, expired, or unaffordable. People whose income is just slightly above the threshold, but who still can't afford care. People who don't understand the application process or who don't have the documentation the system requires. This is the classic tension in means-tested programs. You want to help those who need it most, but you also want to prevent misuse or overspending. The result is often a system that's highly restrictive, administratively complex, and difficult to navigate, especially for seniors who may not be digitally literate or who don't have access to professional help. Health Canada has acknowledged some of these challenges and has promised to improve communication, streamline appeals, and provide better support. But as of now, the system remains rigid, and denials continue. Advocacy groups have been vocal. The Canadian Association of Retired Persons, CARP, has raised concerns about the complexity of the application process and the lack of clear guidance for seniors who are denied. The National Pensioners Federation has called for expanded eligibility and more flexibility in how income is assessed. Dental associations have pointed out that the program, while ambitious, is not reaching many of the Canadians it was designed to help. Provincial governments have been more cautious. Some provinces, like Quebec, have their own dental programs for low-income seniors, and there's been ongoing negotiation about how federal and provincial programs interact. Others, like Ontario and Alberta, have welcomed the federal program but have raised concerns about administrative overlap and confusion. Economists have noted that while the CDCP is a significant investment in preventive health care, its long-term fiscal sustainability depends on controlling enrollment and managing costs. And seniors themselves, those who have been denied, are expressing frustration, confusion, and fear. Many don't know how to appeal, many don't understand why they were rejected, and many are simply giving up. This is a developing situation, and it's one that will require ongoing monitoring, public pressure, and potentially legislative or regulatory changes to fix. So if you've been denied coverage, or if you're worried you might be, what can you do? First, review your denial letter carefully. It should include a reason for the denial. If it says you have existing coverage, verify that. Contact your former employer, your insurance provider, or your provincial health ministry to confirm whether you actually have active dental benefits. If you don't, gather documentation proving that your coverage has ended and submit an appeal. Second, check your income calculation. Log into your CRA My account and review your most recent notice of assessment. Confirm that your adjusted family net income is under $90,000. If your income has changed due to retirement, the death of a spouse, or other life changes, make sure your tax filings are up to date. If necessary, File an adjustment or wait until your next tax return reflects your current income, then reapply. Third, if you're living with adult children or other family members, clarify the household income rules. Contact Service Canada or the CDCP helpline to understand how your specific living arrangement affects eligibility. In some cases, you may need to demonstrate financial independence or separate your tax filings. Fourth, file an appeal if you believe the denial was incorrect. You have the right to request a review of your application. This process can take time, but it's your best option if you believe you were wrongly denied. Include all supporting documents, proof of lack of insurance, updated income statements, and any correspondence with insurers or government agencies. Fifth, seek help. Many community organizations, senior centers, and legal aid clinics offer free assistance with government benefit applications and appeals. Don't try to navigate this alone. Sixth, stay informed. The CDCP is still evolving. Eligibility rules, income thresholds, and coverage details may change as the program matures. Subscribe to updates from Health Canada, follow trusted news sources, and monitor announcements from advocacy groups. And finally, don't give up on your dental health. Even if you're denied federal coverage, explore other options: sliding scale dental clinics, dental schools that offer reduced cost care, provincial programs, or payment plans with your dentist. Your health is too important to delay. Looking ahead, what can we expect? The Canadian Dental Care Plan is still in its early stages. As enrollment grows and the system matures, we're likely to see adjustments. There may be pressure to raise the income threshold, especially as inflation continues to erode purchasing power. There may be calls to simplify the application process and reduce the burden on seniors. There may be changes to how existing coverage is defined and verified. And there may be increased funding to support appeals, outreach, and education. But there's also the possibility that eligibility will remain strict or even tighten further if costs exceed projections. Demographic trends are working against expansion. Canada's population is aging rapidly. By 2030, nearly 1 in 4 Canadians will be over 65. The fiscal pressure on programs like CPP, OAS, GIS, and now the CDCP will only increase. Governments will face difficult choices: expand access and increase spending, or limit eligibility and control costs. For now, the CDCP represents a major step forward in healthcare access. But its implementation is messy, its rules are complex, and its impact is uneven. Canadians who are denied coverage are caught in the gap. And until the system improves, staying informed and advocating for yourself is essential. Here's what you need to remember. The Canadian Dental Care Plan was designed to help millions of uninsured Canadians access dental care. But right now, thousands are being denied, often for reasons they don't fully understand. If you're flagged as having existing coverage, verify it. If your income disqualifies you, make sure the calculation is accurate and up to date. If you're living in a complex household situation, get clarity on the rules. And if you're denied, appeal. This program is too important to let administrative barriers stand in your way. Your dental health affects your overall health, your quality of life, and your financial security. Don't let confusion or frustration keep you from getting the care you need. Stay informed, ask questions, seek help when you need it, and hold the government accountable to deliver on its promise. If this video helped you understand what's happening with the Canadian Dental Care Plan, please subscribe to this channel. Share this with anyone you know who might be affected, especially seniors, retirees, and families planning for retirement. And leave a comment below. Have you applied for the CDCP? Were you approved or denied? What challenges are you facing? Your voice matters. And the more Canadians understand what's happening, the more pressure there will be to fix the problems in this system. This is Joseph. Stay informed, stay prepared, and take care of your health. I'll see you in the next one.